Let's talk about the relationships among Zhang viscera, the liver and the spleen. Here we see the relationship between the liver and the spleen, as is demonstrated mainly in two areas, the digestion of food and the circulation of blood. So we know that the liver is the one that stores the blood and is in charge of conducting and dispersing for the digestion of food, while the spleen is the one that commands the blood and transports and transforms also for the digestion of our food. These two work together so that the nutrients flow properly through our blood. So let's talk about digestion of food. The spleen governs transportation and transformation, and the liver governs conduction and dispersion. The normal ascending-descending of the spleen and the stomach depends upon the movement and regulation of liver qi. The close cooperation between the liver and the spleen ensures the proper digestion of food and drink and the absorption and distribution of the essential nutrients. If stagnant liver qi compromises the spleen's ability to transport and transform, there may be chest and epigastric tightness, loss of appetite, abdominal distension, mucoid feces, and heartburn and eructation. If the spleen is deficient and fails to transport and transform, water and dampness can accumulate and engender endogenous heat. When dampness heat overpowers the liver and the gallbladder, bile can overflow into the skin, causing jaundice. Now for circulation of blood. The spleen is a source of qi and blood, and their accumulation and movement depend upon the spleen's ability to transform. If spleen qi is abundant, then blood production is ample, and the liver has to store blood, and the circulation of blood is normal. If spleen functions are impaired, the source of qi and blood becomes inadequate, or if the spleen is unable to command blood, then there will be deficiency of liver blood. This manifests as loss of appetite, emaciation, and oligomenorrhea or amenorrhea. So thank you for your attention.